Certain patients, because of the complexity of their health issues, are very likely to seek repeated care from different providers within the healthcare system. The cumulative cost of their care can be very high. For example, Elaine is 75 years old and has some memory issues, congestive heart failure, and diabetes, and has been to the emergency room twice in the past 2 months. Today, she has come to the emergency room of her nearby hospital because she is short of breath.
And with the shortness of breath, are you having any pain?
Data shows that throughout our nation's healthcare system, a small number of patients typically generate a high portion of costs. Studies have also shown that closely managing the care of these patients reduces their need to use acute care services. This means better health at lower cost.
I'm going to take these off.
Frequently, patients with complex problems underplay their symptoms and wait too long before seeking medical attention, and they end up in the emergency room. A patient with congestive heart failure and memory issues may forget to take their medications or take it incorrectly. This can result in symptoms like shortness of breath, swelling, and confusion. Today, our complex patients receive support and coordination from experienced nurse care managers. Together, we identify unmet needs, barriers to care, and make a plan to keep the patient safe at home. This provides the best individualized patient care, improves quality, satisfaction, and reduces unnecessary use of medical services.
Hi, Elaine. It's Dolores from Dr. Oreskovich's office. How are you?
Now, when a complex patient like Elaine arrives at the ED, her care manager, Dolores, is immediately notified. Care managers are relatively new members of the primary care team. They keep in close touch with patients and their families and coordinate their care. Dolores calls the ED team to let them know about the complexity of Elaine's condition and her current care plan.
Hey, Kathy, it's Dolores. One of my patients is there with you right now, Elaine Jones. She's got some memory issues. She's having some problems taking her meds correctly.
Before the adoption of integrated care management, Elaine would have likely stayed in the ED for many hours and eventually been admitted to the hospital as an inpatient. But for many high-risk complex patients, hospital admission is not always necessary and often not the best option.
Instead of being admitted, Elaine is going home, where a nurse from Partners Healthcare at Home will arrive within 24 hours to observe her in the home environment, review her care plan, and teach her how to use a pill box for her medications. Integrated care management enables this approach for high-risk complex patients. It reduces unnecessary admissions, shortens time spent in the emergency department, and provides patients with options that best fit their needs.
In 7 days, Elaine will have a follow-up visit with her primary care physician. In the meantime, Dolores, her care manager, is always just a phone call or email away.
How did that go?
Yes, it was wonderful.
Making skilled, high-risk care management an integral part of the healthcare system yields valuable results all around. Coordinated and integrated high-touch care. Care that is efficiently delivered to reduce the overall cost, and care that is appropriate, safe, and effective.